Hello, everyone. Welcome back to the Metacratic podcast. Today, we are going to be talking about technology and health services and how technology impacts our health services. So we live in Canada, and recently we experienced a nationwide outage for Rogers that left a lot of people without cellular data and Wi-Fi. So this led to a few problems, such as emergency services being temporarily halted. And that got me thinking, well, do we rely too much on technology for medical records, medical services? So I think we can take this topic in one of two directions, and you guys can let me know what you think. We can talk about that. So if we should have all medical records being electronic, what's the problems with maybe hacking of medical records and, hackers obtaining our information, which has happened a few times. And we can go in a second direction, which is talking about false medical information online. So what do you guys think?
I think it's a pretty important topic to kind of discuss, because we always talk about how technology is very beneficial for our health, which is true because there's several technologies that we were able to develop with research throughout the years that are really helpful in, getting better treatments for people and generally improving quality of life. But then it's really easy to disregard the obvious drawbacks of relying too heavily on new technologies and kind of letting go of older systems that were put in place for a specific reason. And so there's also a lot of ethical issues with information that is, one, not true, that is being regarded as true by some health professionals for financial gain, which is also becoming increasingly more common. And then when we're talking about theft of information through hacking or other means, because we rely so much on broadcasting data and sharing research and everything, where patient anonymity may not be as well preserved as it would be if it was using an older system, like simpler forms of research journals and stuff like that are less easy to hack into. So there's definitely a lot of nuances, as Stefan kind of touched upon, with technology and its place in healthcare. And so I guess a good way to kind of transition into talking about this in more detail is, what ways should we maybe reduce the amount of technology that is necessary to keep people's data accessible anywhere, right? So we have databases where we put people's data and then everyone can access it, but is that the best way of doing it? Should we maybe go back to having paper records? I don't know if hospitals do, but do you think it's better to kind of keep paper records and send them from hospital to hospital? What are some issues with that? Or should we just keep everything digital?
I mean, maybe we should keep, yeah, like you said, there's a lot of benefits, but then there's also nuances and problems. So maybe, definitely keeping the electronic records in a sense would be good. And obviously in an ideal world would be no hackers, no problems, no bugs, no nothing. But that's unfeasible for now until technology develops. Maybe instead of changing the way in which we deliver, also having backups, so paper records can be good as a backup method. Maybe encrypting information better, not giving full patient details when necessary. But if not necessary, when actually going in for some sort of clinical advice or something, you don't need to give as much information as possible, because there's been a lot of leaks where social insurance numbers have been given away for all of these things, health card numbers, everything. How much of that information, health card numbers are obviously important, but how much of that information that we just send out everywhere is really necessary?
So it's pretty interesting, because whenever you visit a doctor, even a family physician, every single thing that you describe, relating to your situation, it will be recorded. So let's say if you even lost a family member, if you even engage in any behavior that you are talking to your doctor, it's all will be recorded. So I saw that in a clinic with very good details, and it's gonna be there for just all the time. So even if they transfer your data to any other physician, to an insurance company, they can see every single detail about your situation and case. But like, despite all this disadvantage of electronics, I still think it's far more advantages than paper, mostly because the paper is very prone to damage. Like, eventually by time it just gets corrupted. Even if you accidentally, let's say you miss a lab result for a patient and it was written just in a lab, the patient has to do the lab result again, and they might not be in a condition to do so. And also, you would run out of the storage very fast if you just want to use paper. So I think as an alternative, what we can do is that you can still put the medical records electronically, but obviously, like, I don't think you need to add every single minor detail about patient's life. But I think it would be useful to have a backup on an external storage, like an external hard. So whenever, let's say, I don't know, like your internet got cut off, you can still connect that and you still can access some of the patient's information in that backup external storage.
Well, I mean, maybe we could do like something in between. So yeah, paper, just like physical paper may be, unfeasible. And the way that we share information continuously is also, prone to damage as well, getting leaks and things. But I'm not sure what hospitals use now, but don't they have their own internal, not even a network where they just store like electronic data, not like published to the internet, not published to servers, or, I'm no computer expert or anything, but just like, like a PDF or something of a patient's information that's only given or only accessible through the hospital. Is that what they're doing now? And if that case,
Yes.
How are they? Yeah. So then how are people hacking into that information? Is it only through the transfers?
So it
I
is.
think it's not hospital based, right? I think it's like healthcare system based in Canada, where if you go to a different hospital, they'll still be able to like pull up your patient data. I'm not 100% sure on this, but I think that's the case.
Yeah,
Which
it
then
is.
raises the question of servers, right? Like, where is this information stored then? If it can be traced from hospital to hospital.
It can be, because they all use, so there's only 2 servers in Canada, and the newer one that is most commonly used is called Oscar. So every doctor can have access to that, and they just need to put your name and your name will come out. But the thing is, it is like, it has a strata. That means like the patients in your care, you can see their data. I don't know how I don't think, like, let's say a person, like a doctor in Brampton, I don't think they can just search your name and yours and your medical record shop. They have to send that to them. Yeah. So your doctor can look at your medical data through Oscar, but everybody else are using Oscar. The only difference is that it is like confined to a certain number of people you can have access to.
Oscar is used for what they do, but then everything's uploaded to like the web, like the OHIP website, right? Everything was uploaded to whatever Service Ontario, not Service Ontario, but OHIP. And that's just a simple username and password entry, right? No two-factor authentication. Insecure. So you just log into that, then you can get, all your patient records, like whatever you're doing for your billing and, getting all the health card numbers of like patients that you treated in a month's span or whatever. And it's like really, and especially a lot of older physicians, right? They don't have secure passwords, probably.
Yeah.
Right.
That's just the thing about this, right? Like, I'm sure a lot of hospitals in Canada are run on a riders network, right?
Yeah.
So when there's an outage, how are they going to be able to access patient data, right? If they don't have a health record with them, otherwise, like, how are they going to be able to treat a patient when there's no internet? Which I don't think should be the case in a country, because I feel like, conversely, in a country that's not as developed, that has active paper records that maybe the patients have with them, when they go to the doctor, they wouldn't have such an issue because they are not relying on the internet as much. So it kind of goes back to the question of, are older systems better in these situations? Although they are very rare and very situational, it might just still be helpful to give patients a record of, like, I don't know, their previous visits and their conditions and stuff like that. And that's definitely an interesting thing that you guys might have an idea on, like, I don't know if it's good or bad that, let's say, Canada is developed to have access to such servers and such systems where it's just a like button away for physicians to know everything about the patient they need to know, but there are still like drawbacks to it, right?
Yeah, like I feel like that should be the most secure, right? Like you should have like whatever two-factor authentication, like, you know, like random websites that you sign up for, they like won't let you sign up unless you set up two-factor authentication. Queens, for example.
Yeah.
Right, like you have to like put that in place for like really sensitive information for physicians, especially because, you know, patients don't really care about that stuff. They just go to the hospital or they go to their family doctor and they get a checkup or whatever. They're not the ones that are focusing on that, but you've got a lot of information that's stored through this not so well developed security system, right? So also interestingly, Toronto General, I was like there during the outbreak, or not the outbreak, the outage. Too much COVID talk. During the outage, and it was working fine. So I was talking with a bunch of colleagues and like, are we using Bell or do we have our own network? No one knows. I couldn't figure it out. I tried searching it up afterwards and I couldn't figure it out. So it's still a mystery to me what
do you think like even during like a general outage there's some kind of like system in place where important like institutions like hospitals and government branches still have access to the internet even though they technically don't have an internet service provider that's active?
Yeah, maybe they are their own provider. I don't know.
Maybe, right? Like they just have an external access to the internet without like any kind of commercial aspect to it.
Or maybe they
I don't really know how that works.
Maybe they have all of them together.
Right.
Possibly. Because I knew Stony Brooks had internet when the Rogers thing happened.
Weird.
Yeah, so I guess that would make sense and kind of doesn't validate some of my concerns with like access to patient data in a potential outage scenario. But then again, there's still other stuff that's kind of concerning, as you mentioned, with cyber attacks and stuff like that. We don't really know still why Rogers had that outage. It could be a number of things, right? So it's also concerning.
The reason why this topic came to me is because I was supposed to go to the Weekend concert that night. And it was at Rogers Centre in Toronto. And Rogers Centre has gone completely paper-free, which means that you need to use your phone to show your ticket and enter, and their barcode continuously refreshes. So the code that you get, like in your email or whatever, that barcode won't be available. You have to like add it to your wallet or use their app to open it. But the internet was down, so they had to cancel the entire concert. Well, there was
imagine pharmacies are completely
like everyone
paper-free.
does that, right?
Yeah, and then everyone needs to get their prescription medication that they, let's say, but they can't because they don't have internet connection.
Yeah. Or like, I don't see hospitals and pharmacies having a problem now, but if like people keep developing into the completely technological aspect, like what Rogers Centre did, that'd be pretty bad. It
would almost be easier to cripple a system like that, right? Than it will be to cripple a nationwide healthcare system that is entirely paper-based.
Yeah, you have everything in one place.
Yeah,
you're using paper. Everything's spread out, right? You got your tickets for your show. Everyone has their own ticket, right? Everyone has their own thing.
I think that's also, now that I think about it, this might be the reason why a lot of hospitals are still run on older technology, right? One, because the physicians are more like used to working with those things, and that can be very important in an emergency scenario, like using pagers and stuff, like phones or whatever. And so I guess maybe we're not the first people who thought about this stuff, right? And this is like also one factor that plays into why hospitals are kind of like behind in terms of some technology.
But it's funny because the use of like electronic storage for medical records, it's not that recent. They did it in like the beginning of like 1970s. So this is I wouldn't say it's like a new practice, but it is decent. Like they use that for a while. I think they have experience with it, but they still have some papers in case. I think they thought about it well that, okay, if something happened with our electronic storage, we would be crippled. I think that's why they still store some like paper records of patients' data. I think that might be a case.
I mean, like in the case that something were to completely shut down, that'd be pretty bad because things would slow down. But hopefully, yeah, they would have some system in place.
Hopefully. I mean, to be honest, you can always ask patients to like keep their medical records, because most of the time you just hand them like a paper copy, like either of their lab results or like their scans. I think it would be a good idea to like, to just have a small folder and you can have a backup of your own medical records. So if somehow yours erased from a system, you can always bring it back to a physician, and if the system turns back, they can actually put all back into it again.
Yeah, like the vaccines.
I'm kind of surprised by like the efficiency of just keeping paper records, because I was with my family and my grandpa was having some health issues. So he asked me if I would take a look at, his medical history and his recent tests. And I told him that I would probably not be able to help him that much because I'm not a doctor, but I still did. And it was very easy because he had this folder with pretty much all his tests and doctor visits from like the last 10 to 15 years. And it was all right there in front of me. But if I asked him to do the same thing, but everything was in his email, or even if he asked me to show you all that stuff, it'll probably take me hours and hours to find everything, like wherever it is on my laptop or phone, right? So it's kind of almost easier to have an overview of a patient if they just have their paper records with them.
Yeah. I mean, it's like I was, when you're like applying for, a job or whatever, you have to show like immunization. I just have like a folder down there that has like the card. Like, I don't remember what vaccines I got when I was 5 years old and on what day I got them and all the different like rubella, varicella, whatever, all the different vaccines. But, you have that little orange sheet of paper and that shows all of it. So, I mean, that'd be definitely good. I mean, they also I know that Life Labs now has, accounts for looking at lab tests. So like I can see that, which is also pretty good, but yeah.
So basically I think what we want to say about like the future of like keeping records, I feel like we're all in agreement that paper records should definitely persist. Like we should not go entirely paperless. Like even with our generation being extremely interwoven with technology, so it will probably be less of a like hard thing for us to come up with some kind of paperless system where everyone has easy access to their records. But there's still some stuff that could go wrong with that. And so keeping paper is definitely like advantageous. And I don't know how far into the future we can look, but definitely in my lifetime, I would still prefer a hybrid system rather than entirely paperless.
Yeah, who knows? Right now, we prefer hybrid. The older generation prefers paper. Maybe the next generation will completely prefer technology. Who knows?
Right. And I mean, technology will probably also advance in terms of like data privacy and security, right?
Yeah.
So we'll have to see where that goes. And obviously the medical field is one of the places where technological advances first are applied to, because it is one of the most important places where technology can be applied to. So I guess we'll just have to wait and see how things evolve.
It'll take a while though. We've had technology for less than 100 years. We've had paper for a few thousand, so.
It's true.
Talking about misinformation of medical things online. So web entry.
Yeah, misinformation is definitely another really good topic.
Yeah.
All right, so that's it for this week's episode.
Yes. Thank you everyone for listening.
Yeah.